Talking together about organ donation helps make a healthier community. Here's how. This is a story about the brain, how it works, and what can happen if it gets injured. Our brain is soft and is protected by the skull. It keeps us alive by sending messages to different parts of our body through the nervous system. So we can walk, talk, see, eat, smell, hear, and think. Our brain also controls our breathing and our heartbeat. Our heart pumps blood around our body through arteries and veins. These are everywhere in our body, including our brain. Our blood carries food and oxygen to our brain and body. Oxygen is part of the air that we breathe. Oxygen is picked up by our blood through our lungs as we breathe. Our brain would die if it stopped getting oxygen. How our brain can be injured. Our brain can be injured in many ways. By any accident where the head is hit, if there's an infection or tumour in the skull, or if there's a bleed or blood clot causing a stroke. Anything that stops the flow of oxygen to the brain, such as a heart attack or overdose, can also lead to brain injury and brain death. What happens when a person has a brain injury? When our brain gets injured, it can cause bleeding, swelling, pressure and pain. If we have high blood pressure or the blood vessels in our brain are weak, they can break open and bleed. If the blood vessels get blocked, this stops oxygen and blood flow. What happens for brain injury treatment in the intensive care unit? If a brain injury is very serious, the person will have trouble breathing. They will need a breathing machine to help them and calming medicines to make them sleep so they can try and get better. A CT scan takes pictures of the brain so the doctors can see how injured it is. The person will be attached to special monitors and will not be able to talk while on the breathing machine. In an intensive care unit, there will always be one nurse looking after one person all the time. About brain swelling. One problem after the brain is injured is brain swelling. Just like an ankle swells up, the brain can swell too. As the brain swells, pressure builds inside the skull because there is no room for the swelling. When the brain is healthy, the messages go through the brain stem into the nervous system. When the brain is injured and swollen, the messages cannot get through. Doctors and nurses will give medicines to try to stop the brain swelling. Sometimes the swelling still gets worse and an operation is needed to try to stop the damage to the brain. What happens next? Each day the doctors will check the person and decide if they are ready to stop the calming medicines. To help doctors decide, the person may need another CT scan. Usually the calming medicines are stopped a few days after coming to the hospital. When calming medicines are stopped, it may take a while before the doctors know how badly the brain is damaged. What is brain death? Sometimes the brain is damaged very badly and swells so much that blood and oxygen can't get to the brain. When this happens, the doctors need to do more testing to check if the brain is still working. Once the doctors do the tests to check the brain isn't working, they know the brain is dead. This is called brain death. Brain death means the person has passed away, but the heart still beats while the breathing machine is giving air. There are some special tests that two separate doctors must do. You can watch the tests if you wish. If the person does not respond to all these tests, it means the brain and the person has passed away. Even though the person has passed away, the heart will continue to beat while connected to a breathing machine. What is circulatory death? Sometimes people are so sick with an injury or illness they cannot breathe without the machine. Doctors do not think they have any chance of living without the breathing machine and they will pass away without it. The person is given medications to ensure they have no pain or suffering. Their family and friends can be with them when the breathing machine is stopped and the person passes away. After the breathing machine and tube are removed, it can be difficult to predict how quickly the person will pass away. Often, this happens within 10 to 20 minutes, but some people may not pass away until hours or days later. After the machines are removed, doctors will monitor the person's breathing and blood pressure. When the breathing stops, the doctor will wait 5 minutes before confirming the person has passed away. This is the time of death. To learn more about organ and tissue donation, visit the website donatelife.gov.au.